Over half of all Americans will experience a mental health concern at some point in their life. Most originate in childhood. Symptoms often begin as early as preschool or even before. Mental illness is correlated with higher rates of substance abuse, homelessness, incarceration, unemployment, and suicide. Research has also shown that interventions in early childhood are more likely to be effective, and also to have a cumulative effect when paired with continuing intervention throughout the lifespan. For this reason, it is important that we all work together to increase awareness of this issue and take the steps necessary to provide help as early as possible. No matter what your personal or professional background is, you are very likely to come across a child at some point in time who has a diagnosable mental illness. According to a recent publication by the Centers for Disease Control and Prevention, or CDC, in any given year, up to 20% of children in the United States are suffering from a diagnosable mental health disorder. To look at that number differently, 20% is equal to 1 in every 5 children. Data also shows that this number is consistently increasing from year to year. However, in spite of this high number, we also know that about 2/3 of children who need some type of mental health services do not receive them. This leads to a significant underreporting of the actual incidence of mental health disorders in childhood. Knowing that 2/3 of children who would benefit from mental health services do not receive them leads us to the question of why that might be. There are 3 main categories of barriers to mental health care for children. First is structural barriers. This category includes lack of providers, long wait lists, lack of insurance, the cost of services even with insurance, lack of transportation, and inconvenient or inaccessible services. The second category is barriers related to perceptions about mental health problems. Included in this category is an inability by parents, teachers, or medical providers to determine a child's need for services, denial of the severity of the problem, and the belief that the problem will resolve on its own. The third category is barriers related to perceptions about mental health services. This includes lack of trust in mental health providers, previous negative experiences with mental health services, a child who doesn't want help, and the stigma associated with mental health services. Despite the fact that 2/3 of the children who need mental health services do not receive them, the United States still spends $247 billion a year on childhood mental illness. This money is spent primarily on outpatient treatment and prescription drug costs, and also includes the costs of special education and juvenile justice services that can be directly linked to mental health disorders. Despite the high cost, there is also a high cost benefit. One study showed that interventions during childhood for at-risk children, to include various programs such as early intervention in the form of home visits, as well as mental health care when needed, cost about $20,000 per child. This $20,000 investment yields an increase in lifetime income by more than $200,000, and also provides positive benefits to society in the form of additional tax income and lower costs for crime, poor health, and related social problems.